in the interest of clarity, and since I'm more than 6 feet from you, I'm going to go ahead and drop my mask. Good morning. I just want to run over numbers real quick with you, and then I'll take your questions. As of this morning, we have 2,855 total cases in Pitt County. We estimate this morning that 2,083 of those cases are recovered. Unfortunately, we have 15 deaths that we have confirmed and placed in the NCED surveillance system. We have some additional deaths that we have under investigation. That number will likely grow by a couple before the day's end. Again, I offer my heartfelt condolences to all those families and friends who have lost people to COVID-19. Taking those numbers, it leaves us with about 757 active cases in Pitt County at this time. That is up where we had been running between 500 and 600. It is up over where we had been running the last few weeks. If you do the cases per thousand calculation, you come up with 4.1 cases per thousand people in Pitt County. A quick look at our case fatality rate, and it is 0.5 this morning. It's been running about 0.6, so that's actually down a hair, but that fluctuates between 0.5 and 0.7 as we run that calculation. I've been asked to mention isolation and quarantine. Again, isolation is the separation of people exposed to or thought to be at risk for developing an infection. So in this case, COVID-19. Isolation is actually the separation of people with the disease. So we isolate cases, we quarantine the exposed. This past week, we saw very rapid growth, very rapid escalation in the number of cases at East Carolina University, and I have colleagues here from East Carolina University to take your questions this morning regarding that. There are a number of students in both isolation and quarantine at ECU, and we would encourage them to complete that here in Greenville before traveling home. The state is also recommending that any student that's been on campus quarantine for 14 days upon returning home from a university, and that is guidance that's gone out across the state. Happy to take your questions. Okay, do they want to make their statement first? All right, let me step away.
Okay, excuse me. My mask off here. Good morning, everyone. I am Jennifer Johnson, the Public Information Officer for Pitt County Schools, and I am joined today by our PCS Board Chair, Ms. Betsy Flanagan, and our Co-Chair, Melinda Fagundes, who will answer some questions for you. But first of all, today is the 8th day of school for our 36 traditional schools in our system and the 15th day for our early college high schools. So we have to say that operating in Plan B with our students attending either face-to-face or virtually has really been the most logistically complex transitions, one of the most complex transitions we've had to endure as a school system. However, our transportation staff, our teachers, our school nutrition staff, our custodians, our principals, our parents have completed nearly 2 weeks of instruction and orientation. And though it's taken a tremendous amount of effort, we are incredibly proud of how our staff and our parents have responded and adjusted together. So we would be remiss if we didn't thank our PCS families for hanging in there and for persevering with us. We also owe thanks to the Pitt County Health Department for partnering with us this year in a way we've never had to before in reporting, contact tracing, and notifying our families regarding the potential spread of COVID-19 in our school buildings. Over the past few days, we have received many phone calls from parents, staff members, and the media about communications and notifications of positive COVID-19 cases that affect our schools. So today we want to briefly discuss communications protocols for PCS, confirm any positive cases, and let our public know where we are and how we will be distributing PCS data in the future. So first of all, we will begin summarizing our data weekly to be updated and available on Fridays. And that's our district data. That information can be found at bit.ly/PCS COVID data. Again, the first one will be posted tomorrow. That will be posted by noon and will reflect this week's current positive COVID cases. Today, we'd like to share last week's data for those cases that have been reported and have been determined to be what we call school-affected cases. So a school-affected case at PCS simply means that an individual has tested positive for COVID-19 and has recently been physically present on a school campus and has been in close contact with other individuals for more than 15 minutes or without the consistent use of a face covering. So last week's PCS school-affected case count is 4. Since it is our first count, it does include an earlier case from one of our early colleges, which began school on August 6th. These cases are single cases, determined to be from community or family spread outside of Pitt County schools. Those cases are confirmed at Innovation Early College on the campus of ECU, Aden Elementary School, W.H. Robinson Elementary School, and Belvoir Elementary School. After working with the health department to determine the level of exposure, parents and staff members in close contact with the individual were contacted either by letter or by phone call, whichever was the most direct. And then once direct contact was made, a general phone call was also placed to all parents and staff members of the affected school. This week, we can confirm 2 more single cases reported, assessed, and notified at Grifton School and J.H. Rose High School. We would like to point out that with a little over 23,000 students and 3,600 employees, last week's percent of positive school-affected cases represents just 0.01% of our population of students and staff members. The additional 2 cases reported this week bring that percentage to just 0.02% of cases. Again, and of our population. Again, we will provide a summary of cases and percentages at the end of the week on Friday. Finally, we would just like to say that our school employees are working extremely hard, not just to conduct virtual and face-to-face academic lessons, and many times on the same day or the same class period, but our staff is also diligently modeling and practicing the 3 W's, wear, wait, and wash. And strict cleaning protocols are taking place throughout the day and nightly. We would like to for our face-to-face students to remain in school as long as possible, as we believe that face-to-face instruction is always the best option for learning. We do understand that our county, our state, and our nation are living with COVID currently, and we must keep our students and staff as safe as possible. So we are also providing devices, training, and support to our virtual students. But overall, we believe this year, one of the most unique and challenging school years, has gotten off to a great start, and we appreciate the support of our partnering agencies, our staff, and our PCS families who make us Pitt County Schools strong. So at this time, we'll take any questions, or we will turn it over to Dr. Silvernail for questions. Any questions for Pitt County Schools? We do have our board chair and co-chair here as well.
Does there get to be a point where you guys would have to make a decision to go to online learning only? And if so, what is that point?
That's a great question, and that is a decision that the board would have to make. We do work in direct communication with the health department in making those determinations, but if anyone from the board would like to answer that question, I'll allow you to do that.
Yes, I will. I will go ahead and answer that question for you. Do you want me here to answer? Yes, so we have regular conversations with Dr. Silvernail. We are trying to stay on top of the numbers. We actually are going to have a special called meeting tomorrow to talk through the numbers within Pitt County Schools and to discuss what our plan is for moving forward.
Can we get your name too?
Yes, Betsy Flanagan.
Okay.
And so how do you guys overcome the challenges with virtual learning? You know, what has any obstacles any teachers are going through? What are you guys doing to work with them?
Absolutely. Some of our teachers are trying to just learn how to juggle virtual students versus those students that are in class and face-to-face. They are facing challenges with technology, et cetera, but we have a really robust technology department that are taking questions from parents. We have a parent university that we launched. So we really have lots of training available and lots of support available for parents and for students.
Have all the technical difficulties been worked out, or are you guys
Oh, I think that technical difficulties are something that we do face. In the beginning, as you know, there were some difficulties with one of our platforms. That was something completely out of our control and was on a state level. But that was quickly resolved in the very beginning. Any other technological issues we've been able to really talk about and adjust and fix from there. So we really are working together. Any other questions for Pitt County Schools? Those are single cases. Yes, that are school affected single cases, yes.
And do you know the quarantine number? Like say if they haven't been positive, are you guys going to release the amount of quarantine people just as regularly as you do the numbers like you said on Friday?
Right. We are discussing that, and I can say that there are around 46 people that are in quarantine or have been quarantined from those positive school-affected cases. And again, that only comes to about 0.17% of our school population.
And were those entire classes that the students were in?
In some of those cases, there were classes. Those classes were about 6 or 7. We averaged 7 to maybe 10 students per class at this point. And so if an entire class was quarantined, then that accounts for that number.
And you said those single cases, if they were infected with the virus outside of school.
In many of those cases, yes, through routine doctor's visits or just reporting that a positive case or a family member had tested positive and then they were tested and received a positive test. So yes. And the majority of those cases are students. Any other questions?
How many of those cases were teachers?
I don't have that exact number. I can just tell you the majority were students. I can get back to you and let you know. Sure. Anything else? Thank you.
Hello, everyone. As you know, today is the first day of our pivot to remote learning for undergraduates at ECU. And that's an important day in everybody's life, a difficult day for sure, for students, for faculty, for staff at ECU. The decision to pivot was a difficult one that we had to take seriously. As we watched the numbers accelerate late in the last week, I recall having a phone conversation with Dr. Silvernail on Saturday morning, and he was in full support of watching these numbers, making sure that we made a good decision. I talked later with President Peter Hans. I'm grateful for the support of President Hans and his approval of pivoting. Our goal is to de-densify campus in large part. You already know that we have 11 clusters. I think if you looked at the numbers over the last week, Monday to Monday, we're probably right around 400 positive tests amongst the students with an infection rate that exceeds 25%. In addition to turning to our remote online education for our undergraduates, we have only permitted students to remain in residence halls by exception, and the exceptions might include international students, student athletes, and students who have special needs, like access to technology that they might not have at home. So we're expecting to reduce the number of residents in our residence halls from probably 5,500 or thereabouts to about 800. All 800 will be tested. All 800 will be tested. Those students who are currently in isolation and quarantine will remain until they're through that 14-day period. Campus services will remain open for our students, who many of whom remain local. As we de-densify the campus, we'll return our isolation and quarantine capacity onto campus for the benefit of our students. We're turning our attention right now to I guess the general issue of our own expectations, behavioral expectations, responsibilities for our students. We have a meeting next week. Dr. Silvernail and his team with the city There's a tremendous, as you know, partnership between ECU Police Department, Greenville Police Department. Responsible Behavior Initiative has been ongoing for several weeks now, and we're doing the best we can to make sure that our students comply and that they certainly understand their responsibilities. So we'll turn our attention very, very carefully to that issue of compliance and enforcement over the next few weeks so that we move through the next months together in a positive way. Football's still on pause. We have not released them to return to practice yet. We're hopeful we'll have clarity on that by the end of today, and that my hope, of course, is that they can return to the practice field and get ready for a Marshall game on September 12th. That's the plan. I would take questions.
Dr. Mitchell, there was
Yep.
understand there was a meeting walkthrough between Dr. Silvernail and ECU officials last week. What was the purpose of that meeting or walkthrough, and who asked for it?
Yeah, so the game day experience is something that we're thinking about, and for us to portray the capacity of that facility, the stadium, and for us to illustrate what a private box looks like, we thought it would be much better if Dr. Silvernail could experience that, could see it for himself, and perhaps make some suggestions on how we could accommodate the folks. We still have not come to a final determination on that first game day attendance. I've indicated earlier that it'll be highly limited for sure, and that as we get comfortable, I think we all hope that we can scale up and have plenty of fans in the stadium by the time the season ends.
You made the announcement Sunday that there would be no tailgating
On ECU
on
campus.
ECU campus.
Yeah.
Is there a deadline when you'd like to make an announcement whether rank and file fans could attend the game?
It's got to be pretty soon, doesn't it? I mean, it's. I would say we're probably looking at something by the end of the week.
I had a question about some people that messaged us about Paramount saying that possibly some students who have either tested positive and quarantined, whatever the case may be, have been moved to Paramount, and people were saying there wasn't enough warning or they weren't warned at all. What can you tell me about the situation, if that's true, and what have you guys done within that transition?
Yeah, so our capacity for isolation and quarantine is off campus. I think we try to do it in as compassionate and supportive a way as possible with personal transportation, and we deliver the food to those students. It's difficult for everybody. I mean, there's no doubt about that. So I think we're doing our best to be supportive to those students, and it would not be surprising to me that some would be unhappy about it. It's not an easy thing to be quarantined and isolated. So part of our strategy, as I mentioned, is to de-densify the campus and return that capacity to our campus so that we can take even better care of those students who test positive or need to be in quarantine for close contact.
So were they warned at all? Is there a rule about telling people that live in the apartment complex or the landlord, whoever, before they move back in there? If they're
I would expect that that's a landlord's responsibility.
okay, so we don't know if they've been warned through ECU. Is my
Yeah, we did not warn the residents in general. We would assume that the landlord would take that responsibility.
Do you know how many?
How many
How many students have?
are in quarantine and isolation there? So again, our off-campus capacity is significant. We have, I think we're at capacity there at roughly 70, between 70 and 80 students there.
Do you have any concerns about students moving back home and bringing any of those clusters back home to where they live? You know, should parents be concerned about the students that are going back home for virtual?
Yeah, well, we're pretty strongly encouraging students if they've tested positive or in fact have been exposed, right, a contact, that they not return home until they are further tested or they go through that 14-day period. So we don't want them to go home. I mean, we're not encouraging that in the least. We certainly will follow the guidance from North Carolina Division of Health and Human Services that when they do return home, that they self-quarantine for 14 days.
And with many of the infections happening off campus, like with parties? How is ECU working with law enforcement to monitor that with a lot of students staying local, but
Yeah.
off campus?
Yeah, so that's that topic of compliance and enforcement. And this meeting next week, I'm hopeful that we will develop a very comprehensive approach to making sure students understand the need, right, which we've tried to do for weeks now, for compliance, that it's not only in their self-interest, but the interest of all others that they are compliant, but also that there will be consequences. And we've certainly ratcheted up, I would say, the heat on compliance. We have seen a reduced volume of those parties, but I would remind everybody that the real enemy here, as far as I'm concerned, is the disease, and the students gather. I think a lot of this transmission is not just parties, right? It's people sitting on a couch and playing a video game. So I think we could go overboard with the party thing, but we're on it.
Many students I speak to, they say they feel like they're not getting that college experience. They definitely understand why they need to go virtual. How many students, or just a number of students that have pulled out of schools after the decision to switch to virtual learning?
So how many have withdrawn?
Yeah.
It's a trickle. I mean, it's a small number. We won't know the final number until Friday because we extended the withdrawal period so that students would have greater choice in the matter. So Friday we should get the final count on. But the numbers I've seen are a trickle. So we're going to serve them very, very well. We know how to do online education really, really well at ECU, and are regarded as North Carolina's leader in online education.
Dr. Mitchell, to get back on the football question, you said Dr. Silvernail did a walkthrough at Town Bank Tower with you guys.
Yep.
Is there a scenario where even if fans can't sit in the stands, that being a private area and a private building where suite holders and club level ticket holders could possibly still attend since it's a private area versus the stadium as a whole?
Mm-hmm. Certainly that's under consideration, so that's a possibility for sure. Yep. I think we would, for the most part, treat a private box like a household, and so that's a definite possibility, certainly in the planning. And I want to make sure I clarify. I didn't say Paramount, but that's okay.
So is it just an off-campus complex? You don't confirm where?
We don't confirm where, but others have, so that's okay.
So,
Question?
did ECU have to get more units than they originally planned?
Yes. So we have scaled as the frequency, as the volume of those testing positive has increased or the need for quarantine has increased, we have scaled appropriately. All students who are resident on our campus have been placed in appropriate locations for quarantine and isolation.
And that is 70 units, correct?
In that one location, yeah.
Okay. Are there any other locations?
Yes, there are.
And how many units are being used for?
I think the total is 99.
Okay, so 99 students are in university quarantine through multiple
Mm-hmm.
housing.
Mm-hmm. I think that's a fair description.
Okay. And this is apartment complexes in Greenville that they are at?
A variety of living quarters, let's say. Yeah.
What would you say to those students who say ECU is not being transparent if they don't feel the responsibility is for the school to tell them the students are being quarantined in off-campus, apartments? What would be your response to people who are like, well, how are we supposed to know if the landlord isn't doing it?
Yeah. I mean, it's a valid question. I still think it's a landlord's responsibility. Our relationship, our agreement is with a landlord. It's contractual.
And, since students do need to come to your advisory to for 14 days before they go home, will ECU have to get more units at any apartment?
So those who have tested or have been in close contact are to stay here for 14 days. I do think our volume will continue to grow. We anticipate that. And that's one of the important reasons why we want to move that quarantine and isolation capacity back to our campus so that we know what the capacity is. I mean, we will dedicate a full dorm to that purpose. Those students will all be in singles. All those students who stay with us will be in singles going forward for the remainder of this semester.
And since students are being off campus, how many students do you plan or do you think will stay in Greenville?
You know, the majority of students who live on our campus in residence halls are first-year students, and most of those will return home. The vast majority will return home. They don't know enough about the community, that they don't have the connections. So I think the majority will return home. There'll be some who seek local housing, and that has happened as well.
Do you have any concerns with Paramount being in violation by the city of being dirty? They actually dealt with some violations a couple of weeks ago that I did a story on, and they were, cited for multiple things, not being clean, not being ready for the students to get there, and then possibly moving those students to those off-campus complexes like them. Does that raise any concerns?
ECU employees inspect every room that we employ, regardless of location. Every room gets inspected.
Off-campus students?
Yeah.
And back to students, some students are going to still stay here, so are students partying still going to be a concern?
That's related to a previous question and something that I said. Our emphasis on students complying with our expectations and with the governor's executive order and the enforcement that's needed to improve that is an emphasis that and we have ratcheted up enforcement. There is less of that noteworthy partying than there was. I still want to make sure that everybody understands that's a small group of students compared to our total student population of 29,000 students. And the transmission that takes place is not simply parties.
Ron, as you know, there's a big difference between someone testing positive and someone being in the hospital. And I know you can't get into specific cases, but are most of these cases we're hearing with students are asymptomatic, that they're not in the hospital?
Yeah, I mean, I don't know if I would describe them as asymptomatic. Mild symptoms, I think that's fair. Lanika Wright, who heads up Student Health Services, is here. She could probably say a lot more about the actual condition of the students. I don't think I mentioned 400 or thereabouts since last Monday tested positive. I don't think a single one has gone to the hospital. And there's a lag there. I think, at least my understanding is, and the professionals can talk more about it, there's a lag there between the infection and the detection of the infection and hospitalization. There's a bit of a lag there, so we might still expect some hospitalization. We hope not, of course.
And are ECU cases included in county data?
I think they all are right now. We probably have some students who are from different counties who don't test locally, and we might not catch all of those. But I think that's a small number. Did I get that right?
Yeah.
Okay. It's typical that I get things almost right. Are we good? Thank you. So let me follow up on Elizabeth's last question about the public health reporting. Public health reporting for communicable disease or other conditions goes to county of residence. So for students who use a Pitt County address, that would come to us through the system. If a student were to be tested out of the county, use a home address, that may go to the home county first. There's an effort underway across the state to make sure that cases get shared with the county where the student attends a college or university and their home county in the system, so that that data is visible to both parties as needed. Yeah, it would go to is that Chatham County? I forget what county that is. Orange County, I think, isn't it? Yeah, so if you're living in Chapel Hill and tested in Chapel Hill with a Chapel Hill address, that data, that report will likely go to the health department there first. If your family's from Pitt County, you're from Pitt County, hopefully they will share that with us, make that visible to us as well. And we try to do the same thing for other counties, for kids that are here for university but may live in Mecklenburg or Wake or wherever. Okay.
So I have just a logistical question because I don't know how it works. What is the jurisdiction of a county health director when it comes to a major athletic program like ECU? What can you do? What can't you do? Are you able to shut down a program if you don't like what you see, or are you able to limit fans in the stands? What abilities and powers do you have as health director?
In general, the health director's abilities are very broad in the terms of control of communicable disease, or in the control of something that's an imminent public health hazard. It would be hard, that bar is set high intentionally. I'm not sure that I could shut down the athletic program at ECU. I think that would be a partnership between myself and the chancellor and the athletic director, and we have all had some meetings together and talking about those things. But I don't think I would unilaterally be able to make that decision.
What were your thoughts after going on campus Friday, after taking a
tour? I think it's a beautiful facility. I've only seen that once before. Since I moved, I have not, and not that I don't like the Pirates. I want to be clear about that. Go Pirates. But my work schedule, family schedule, I have never attended an ECU football game in person. I've seen the stadium once before from the Murphy Center, from an event at the Murphy Center. So it was good to walk through, see how people flow in and out of the stadium, see how the seats are laid out, how the different types of seating are laid out, and how we can maintain social distancing in those areas. So my visit was a visit of technical assistance to these folks to help them identify vulnerabilities where even if we cohort groups that come in together as households or families, where that cohorting could break down. And I think we had a nice discussion and identified some areas of vulnerability that they're working to fix.
One of the big part of the ability for fans to even attend come from the state level. If the state doesn't move out of phase 2, it's even physically possible. Absolutely,
and I think that's why the ECU folks are on pins and needles, waiting on bated breath. Right now, the outdoor gathering limit is set at 25 per the governor's order. It's likely that will be amended the week of September 11th. His current order expires on Friday, September 11th. So we would anticipate that a decision on whether to move forward or just stay in place would be made probably by the middle of that week.
And if amended, what do you think it would look like?
I don't know. State trends were favorable with the universities reopening. The state data has kind of taken an upturn. If you look at the state curve, our what we would call an epidemic curve was in a downslope. Our cases were declining. The numbers had been moving in a favorable direction for probably the last 4 or 5 weeks. With the universities returning, with the clusters on university campuses, that trend has been reversed and has been bumped up. So I suspect we'll see a second peak before that goes back down.
I want to follow up with you too about the students moving back home after being in quarantine or dealt with anything on campus here. Do you have any concerns with the students who are on campus that are in quarantine, bringing that potentially back home to their families?
So question is about students in isolation or quarantine. So those students that are in isolation, we would want them to complete their isolation here and meet the criteria for release from isolation, which is at least 10 days from diagnosis or onset of symptoms. If you had symptoms, improvement in the symptoms, and then having no fever for at least 24 hours prior to hitting that 10th day. And that's what the CDC guidelines are in terms of considering someone suitable for removal of isolation. Once they meet that criteria of recovery and are suitable for removal from isolation, they would not be infectious and could travel freely. Those in quarantine would need to complete the 14 days of quarantine. If they had not developed the disease in 14 days, then they also would be considered not at risk and could travel freely. The question is are there unidentified cases? And in epidemiology, everything's always an estimate. It's hard to count every case, especially in a population of 20,000 plus students. So there may be students who are incubating this that we don't know that are incubating this. whether they acquired it on campus or in the community. And there's a move afoot to say the students, when you return home, to self-quarantine for 14 days before you move freely in your community upon returning home.
Do you have any concerns, with the 3 apartment complexes in Greenville that have been in violation for being dirty? We haven't heard any updates on if all of them have been cleaned or updated, and then again, moving 6 students or students in quarantine to those apartment complexes. Does that pose any higher risk with that many people in there, or if they're already dirty and then moving?
Well, as the Chancellor said, the complexes, at least the parts of them that they're using, are inspected by their staff. So hopefully that dirty issue isn't an issue. I had not heard that from anyone before. Obviously, we'd want people in a clean apartment. People in isolation are in isolation. They're not supposed to leave the apartment. So they should not pose a risk to others in the complex, provided they are following their isolation guidelines.
Earlier you said that there were still a few deaths in the county.
Mm-hmm.
You said there were some deaths under investigation in the county. Can you give an overview of what a COVID-19 death is?
The state guidance for us to consider something a COVID-19 death is a clinical syndrome compatible with COVID-19, so they have to have signs and symptoms of the disease. They have to have a positive test, and at this time that's still a real-time PCR test, and they have to have died of the syndrome of COVID-19 without a period of recovery in between. So if I had COVID and I got better and then I got in a car accident or I had a heart attack, unless it's clearly linked back to the COVID, that would be considered a non-COVID death at that point. So we receive, the hospital tends to, if someone's in the hospital had a positive test for COVID, they refer those to us. We go through the medical records, we look at that definition that's been given to us by the state health department, and we see if that matches the definition, and then we file the report through the North Carolina Electronic Disease Surveillance System, or NCEDS, and then it will go on the state website once we complete that process.
I've seen some death certificates that list COVID-19 because of death,
Mm-hmm.
and that matches up with some of the dates, and then some of them don't match up with some of the dates reported. So,
Vital statistics data, which are birth and death certificates, are currently not included in the state totals or in our totals, and that was at the direction of the state epidemiologist. So some death certificates may list that based on a presumptive diagnosis. If there's no test to support it, it would not meet what we call our surveillance definition for a COVID-19 death. At some point, I believe the state plans to go back into the death records and pull out those cases not identified as COVID by testing and report that number separately.
so is that if they have like symptoms of COVID, but we're never able to test?
When a physician completes a physician or a advanced practice provider completes a certificate of death, that provider is obliged to put what they believe the cause of death to be, and that often is clinical judgment. So if the person had fever, cough, pneumonia type symptoms, and it was believed to be COVID, they may very well put COVID or coronavirus as the cause of death. But if there's not a test to support that, under the current definition that we've been given to use, we can't call it a COVID death. So that will be pulled out separately when the state goes back and analyzes the vital statistics data.
Because I've seen 3 death records that match the address of second scan,
Mm-hmm.
but only 1 is reported. So if you kind of get an idea of that, is that
There is an ongoing outbreak there. We did have 2 deaths reported to us over the weekend that were potentially linked to that. I really don't want to say too much more because then I inadvertently disclose the individual. We do have to validate those and put them in the system before they'll show up on the state website.
but can you say when the first case broke out at the Pitt County Detention Center?
I was notified late last week that they had a cluster or an outbreak in a housing unit. This unit is a barracks style unit, so there are not individual cells. And at that time there were 7 positive individuals out of 11 that had been tested.
So this had only been going on for the past
It would look, these individuals had mild symptoms, so it would look like it was of recent duration, recent onset. It's likely it came in with a guard who had an asymptomatic infection. Okay. Other questions? You always have a straggling question.
I do. I always do.
Okay. Thank you, folks. Have a good day.
Thank you.
Troy, nice to meet you. And you're pirate radio, right?
Yes, sir.
Okay.
Yep.
I'm gonna step away and I'll mask up so you don't get my cooties.